Anemia is defined as an abnormally low number of circulating red blood cells, which act as the boxcars to carry oxygen to cells. It is caused by decreased red blood cells or decreased hemoglobin. Symptoms of anemia can manifest in various body systems, including the skin and mucous membranes, heart, respiratory system, tissues, bone, and the central nervous system. Types of anemia include those caused by blood loss and nutritional deficiencies such as iron, B12, or folic acid deficiency. Other types are genetic, like sickle cell disease, thalassemia, and aplastic anemia, which can lead to thrombocytopenia. Diagnostic tests for anemia include a complete blood count, hemoglobin and hematocrit, serum ferritin and iron levels, and hemoglobin electrophoresis. Other tests include iron binding capacity, sickle cell test, Schilling test for B12, bone marrow biopsy, and assay of G6PD. Nursing care focuses on managing thrombocytopenia and bleeding risk, which includes careful consideration of injections, monitoring for bruising, and checking platelet counts. For neutropenia, infection risk is managed by precautions like avoiding fresh fruit, vegetables, and flowers. Management of anemia involves dietary modification, complementary therapies, and medication. Common medications include iron, folic acid, B12, and erythropoietin. Maslow's hierarchy of needs helps define the priorities of care. We must first address physiological needs, followed by safety, love and belonging, esteem, and finally, self-actualization. Cultural competence is essential in healthcare. Culture significantly affects health beliefs and influences how individuals and communities deal with illnesses. We will now discuss different types of cancer, starting with colon cancer. This image provides an overview of the colon and surrounding structures, including the small intestine, stomach, rectum, and lymph nodes. Colon cancer is also referred to as colorectal cancer. We will discuss metastasis and the affected structures in this video. Colorectal cancer is the third most common cancer, and the incidence has been declining in recent years. Risk factors include age, family history, diet, and radiation exposure. To decrease the risk factors for colon cancer, individuals can modify their diet, take multivitamins, exercise regularly, and potentially use aspirin and NSAIDs as recommended by a healthcare provider. There are several recommended screenings for colorectal cancer for men and women over 45 years old. These include fecal occult blood test, fecal immunochemical test, flexible sigmoidoscopy, double contrast barium enema, colonoscopy, and CT colonography. Frequencies vary, usually starting at age 45 or 50. Signs and symptoms of colorectal cancer in a client may include rectal bleeding, a change in bowel habits, pain, anorexia, and weight loss. Diagnostic tests for colorectal cancer include stool for occult blood, complete blood count, and CEA, which is the carcinoembryonic antigen. Procedures like sigmoidoscopy, colonoscopy, and different types of radiology are also used. This image illustrates the prevalence of cancer in different areas of the large intestine, showing where tumors are most likely to occur. Surgical treatment involves the resection of the tumor, adjacent colon, and regional lymph nodes. Fulguration is another treatment option. This image shows different colostomy locations corresponding to the areas of the colon, including transverse, ascending, descending, ileostomy, cecicostomy, and sigmoid colostomies. Treatment options for colon cancer include pharmacologic management and radiation, which is often used as an adjunct to the pharmacological approach. Assessment involves taking a health history, conducting a physical examination, and identifying risk factors such as a history of rectal polyps or inflammatory bowel disease.